Today I've been joined by the CEO from Virtus Health, Sue Channon. Sue, welcome to the Morgans Network. Just wondering if we could start off by a little brief description of the Virtus story.
Yeah, Virtus is a global provider of assisted reproductive services or fertility services with a growing international strategy. And we've executed that international strategy over recent times with the acquisition of clinics in Ireland and a greenfield development in Singapore. And we continue to work on that international expansion strategy. That forms a big part of our growth strategy. We are a research-driven organisation, and the services that we deliver are backed by that strong research. The pioneers or founders of our organisation brought fertility services to Australia, Australian couples, and that whole research-driven service delivery continues in the organisation. For example, we were first in Australia to launch the Fertility Centre or the low-cost brand. We have recently brought genetic services to Australian couples, particularly around the area of reproductive medicine. So that includes pre-conception screening and fertility testing. We were the first to bring carrier mapping to the Australian public. So really have a strong focus on that research-driven service development. In addition to that, our strategy over the years has been vertical integration and diversification. So these services we provide now within our organisation are services we previously sought from third-party providers like diagnostics and like day hospital services. So really have brought all of that in-house and now provide those services within the organisation to our patients.
Okay, so what are the key drivers for IVF for women?
As you know, Scott, infertility is a medical condition. Around 1 in 6 couples will have an issue with their fertility. The average age of first-time mothers in Australia is 31. That has been increasing over the years. The fertility rate in Australia currently sits at 1.88. It's the lowest it's been in a decade. We see more, the average age of our patients is 37, so we see more and more complex fertility issues. And that's where the Virtus model supports those patients with those complex fertility issues. We have the genetics, we have advanced sciences and diagnostics to be able to treat those complex conditions, and we have fertility specialists. We have over 100 fertility specialists in Australia caring for those patients, and that's really one of the key points of difference in the Virtus model. The other key drivers of infertility include same-sex and single women. We're providing services to different sorts of families now, so our donor programs have certainly been growing. The range of sciences and diagnostics we have, as I said, allows us to treat a much greater number of patients than we were able to ever treat in the past. So those are really all the key drivers of growth within the organisation.
So you've got a successful business model in Australia, and you've spoken about your overseas expansion. Is the model translating well into some of those overseas countries? It
is. Probably more from a business model perspective than a clinical perspective. These type of fertility services provided in Ireland are very good. They've UK and Australia led the world in terms of fertility services. So the services provided in Ireland, as I said, are very, very good. But where we see we've added significant value is through the business model that we have, introducing certain KPIs, the way we do things. So we've been very actually pleased with the level of value we've been able to bring, and it really does consolidate in our mind that going offshore is a good strategy. We have Singapore, as you know, that the Singapore clinic was a greenfield site. It has taken us a little longer than we expected to bring that to break even, but we do believe as we go into FY17 we'll see profit in the Singapore clinic with a number of strategies we've been introducing recently.
And you've spoken about the vertical integration, the diagnostic and day hospital services. Do you want to explain some of the more interesting new tests that are coming through that people are being attracted to?
I think we've spoken in the past about the fact that our doctors were coming back from international conferences and telling us that genetics is the next thing in reproductive medicine, and we're certainly seeing that. In the last half we saw a 54% increase in pre-genetic screening testing within Virtus, and that was the result of a couple of things. We were able to bring our pricing structure down because the technology is becoming more routine, the cost of consumables has come down, we're getting better at using that technology. So PGS is where we take a single cell from an embryo and we test that for chromosomal abnormalities, and that goes to the point I made previously about the average age of our patients being 37, having complex fertility issues, and with that testing we can tell them if their embryo is has a greater chance of implantation than their other embryos. So that's giving them a greater chance of success. So PGS, we've recently run a roadshow internally across all of our doctors to launch our infertility panel and our preconception screening. That allows us to look at a couple's blood and tell them out of the 500 different diseases that would put a baby into a neonatal intensive care unit, whether they're carriers of those diseases. And I think we'll find over time, over the next 3 to 5 years, couples, not just the infertile couple, but fertile couples will also want to get access to genetic screening as they seek to have a child that is free from any nasty genetic disease.
Well, that sounds very exciting for the couples going forward. So just thinking about Virtus and the next 12 months, what can we look forward to?
Look, we delivered revenue and earnings growth in the last half, and that's the result of cycle volume increases across all our geographies. We'll continue to undertake our domestic and international expansion strategy, continue to provide and invest in the range of sciences and diagnostics that will support couples in their aspirations to have a family. So I think those are really the key things, and our vertical integration and diversification strategy is key going forward for Virtus.
Okay, we might leave it there. Thank you very much, Sue, for
Thanks,
joining
Rob.
the Mortgage Network today. I've been speaking with Sue Channon, who's the CEO from Virtus Health.